Try this, buckle up. Buckle up, Buttercup. All right, so here is Lissette. She's 68 years old. I think that's right. Lissette. Kind of an old-fashioned name, right? She's 68. She's 5'4". So immediately, you know, at 5'4" and she's 68, she's got pituitary problems. Be interesting to see her journey up all her life to 68 years old with a pituitary weakness. What did she experience? And when I interview a lot of you females with that, boy, menstruation problems, pain, excessive bleeding. I mean, you can just go through the 9 yards to no menstruation at all. So all of these things can happen to a lady, which I'm for the ladies. We need to fix the ladies up so they're healthy and, you know, they don't struggle with these sort of things. I can't imagine any male wanted to go through what females go through. I honor females because you guys go through a lot. And tell you, GBM is what this is about, so I don't know what that is. My mother was 67 and in May 24 was diagnosed with GBM, unmethylated wild type grade 4. Refers to glioblastoma, brain tumor that is considered the most aggressive type, grade 4. Well, the differentiations between all these different levels is simply the degree or the chronicness of the problem, the chronicness of the agglomeration. It doesn't matter where the tumor is, guys. It doesn't matter if it's in the brain. It doesn't matter if it's in your heart. It doesn't matter if it's in your lungs. It doesn't matter if it's in your liver. It doesn't matter. One site isn't any more special than another. The further away from the kidneys, the more problematic, in my opinion, right? And then when you're dealing in brain tumors, you got to come through here. A lot of people have had their tonsils taken out, you know, and their lymph system messed with. So, and then of course you got the drainage, right? So, you're always going to work on the neurolymphatic points. Why? Because they open the door of the lymph drainage. Very important, and that's also the lymph. These points to the kidneys. You work that all the way up to all the way down, right? Hot and cold, right? At the same time, my case, I'm going to do 2 to 3 kidney formulas. Bam, 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 and I'm going to do them 3 times a day or 4 times a day. A dropper full or 2 dropper fulls. I'm going to make those kidneys come to listen to me. At the same time, I want those adrenals to perk up too because they turn on the kidneys. They turn on everything. Autonomic, right? Plus the sugars, that's your ATPs and everything. You don't metabolize sugars, you're screwed and tattooed. So you got all these things like that these precious adrenal glands do. So am I going after the endocrine glands? Oh yeah. I'm going after the adrenals. I'm going after the pituitary. I'm going after the parathyroid. And in this case, for sure. Because I can't imagine a 68 or a year-old female that has a chronic pituitary issue that has not had problems either conceiving or with their children or holding to term. All these things are almost always into the pituitary gland. Rarely are they just focused on the ovaries. Ovaries get their commands from the pituitary. Thank you, sir. So, when you wake up into a chronic level, that's in a stage 4 level. All right, you all the stops. You don't. Oh, I can't eat this. I can't. Forget that. Put that and throw it in the waste can. Buckle up. Get on grapes. They're going on a grape diet. You're in trouble. You've got to start opening up the body as fast as you can. And opening up the body, the never word for that is hydration. You're very acidic. It's destroying your cells. Your body's collecting all this into a tumor. But you want to get this out of there. And it has to go out the normal way. I mean, Some might come through the sinuses. I don't know. But down the back of the throat, we might be able to hawk some of that tumor out down out from the back. But you got to break it up first and open up those pathways of the lymph. So I would also add a lymphatic formula. I would probably only start with one lymphatic formula and a bunch of kidney formulas. I'm going to the endocrine gland formulas, right? Right. I probably will hit those adrenals with a little extra, generally glandular for the adrenals, but it don't matter. Hit them hard. And then I want to give a pituitary herbal formula and a parathyroid glandular formula. I've got to strengthen. At the same time, I'm trying to open up. You know, I'm asking the body to clean itself, but at the same time strengthen itself. Well, wait a minute. I can't clean and strengthen at the same time. Yes, you can. That's the beauty of the one. That's the beauty of the magic of herbs, the magic of life. She already had a craniotomy on left side and had done a 15 supplement regimen. 15 supplement, holy crap. See, this one, you got to focus in on the system. You don't throw crap in on the system. For 2 months that seemed promising, but she stopped it. I have started lion's mane, cordy, and turkey tail. Wow, I'm familiar with any of them. You have to tell me. Send it in, tell me what they are. Tincture, which has its days. I would like to know. I bought ivermectin. Yeah, I know. People are taking it. All I know is there are some health people taking it too. So if you want to take it, take it. Ivermectin. We were using it in Florida a lot with the gel from vet store because doctors refuse to, prescribe it for her for lymphatic problems, right? I have started it due to her being on Eliquis, but no, the prescription pills they gave her she wants off of. How do I go curing my mama so she can try to regain control of her life again? Grapes, 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 and more grapes. How could the power of a little old grape open up a body and help pull out a tumor? Then with that, you're going to add these herbal formulas if you can get them. And if you can't get them, then you're looking for herbs that are for the lymphatic system. You're looking for herbs that are for the kidneys. Any of the barbarous family, in other words, herbs that are more like burdock, can also be good for the lymphatic system. Red clover is also good for the lymphatic system. Your country might have but she's here in the States. But I don't know about these herbs that you're using. Don't know, can't give you a clue on them. They're not common herbs used. And when you start getting out of the realm of some of these, I don't know. I don't know. I don't even know if we can use graviola anymore again. I never did ask them. I had to find out because I was using graviola, bitter melon, all of those. When you wake up to a tumor, you're waking up to a very agglomerated condition. I've been telling this for years on this. When you see a swelling, take it seriously. Get it out of there. And then you're going to go where, though? What is generally closed? Where's the door closed in your body that's making all this up? Because to have a swelling, you have to have a blockage. Come on. To have a stroke, you have to have a blockage. Where's the doors that are closed? One on the right, one on the left. They're called kidneys. And you've got the largest kidney, the third kidney of the body, your largest, the skin. And that's thyroid, your other kidneys, adrenals.